So Chess has two hubs for our clinical operations, and they include Care Coordination and Care Management Hub and our Pharmacy Services Hub. Chess realized very early on that we had to invest in the team that sits around clinical practice, and that physicians need helpers. They need folks to make calls to pharmacies and pharmacists. They need folks to check on patients after they've been discharged. To do that, we are willing to hire up a hub, train them, and then deploy them on the patients within our value business and pop health ops. They're really the foot soldiers in this battle against cost and disease. The hubs every morning have nurses and pharmacists reaching out to practices and to patients and to their families and to social workers to figure out what next needs to be done for this patient. A common patient interaction is an elderly patient has been admitted to the hospital, had a course, had some changes to his or her medications, and now they're on the way home, and they're often intimidated and confused, not only by the medicine, but even by a bit of that hospital stay itself. You really require a warm handoff to have patients do well in that setting. The evidence has shown that you have about a 7-day period after that patient has been discharged to get them back to see their primary care doctor so that you can reduce their risk for having to go to the hospital again. And hospitals are important places, but our goal is to keep people out of them. So that's where we focus. How can we keep people out of hospitals? How do we keep them healthy at home? Our pharmacy service is doing the same. We're going over patients' meds to see where there are changes, to see if they're safe, to see if they might be too expensive and whether there's a cheaper option that can be put into place. Both hubs work with one another, refer to one another. You can have a patient that's called by a care coordination who may need some medical equipment like a cane or maybe need a wheelchair at home, who often that nurse finds out, oh, this patient is on a couple dozen meds. There might be a couple that are interacting with one another. She really needs to talk to a pharmacist, so she'll move that patient over by telephone to have a pharmacist work with that patient on their meds. That pharmacist may need to call that patient's doctor to discuss some options to consider when it comes to treatment. So globally, you can think of our hubs as patient advocates. We have clinical knowledge, but also have the heart to care about what happens to this patient, and we have the time to reach out to them. Physician practices could do this, but docs need to be able to see patients one at a time and spend their time on that, not spend their time on the phone all day trying to figure out what's happening everywhere. We give the docs time to do the work that they do best, and we can take care of the teamwork.